My name's Dr. Lederman. We're here to explore about prostate cancer therapy and what happens to actual men over the years who've gone through different forms of therapy. And we're here with Johnny Braggs today, who we met how many years ago?
12 years ago, Doc.
12 years. And you came to me because you had a urinary problem, right?
Yes, and because of you, with the test that you had ran on me, I discovered that I'd had prostate cancer, and I'm so glad that I did find you.
Well, not too many people are happy they found cancer. So why are you so happy you found a cancer?
Because, well, I'm not happy that I found a cancer. I'm happy that I found a doctor that could take care of the cancer that I had. And it seemed as though whoever else I went to prior to you, they didn't know what was going on.
That helps. Experience helps. But also, you have an experience also. You have a dad, I think, who had prostate cancer.
Yes.
And you have an uncle who had prostate cancer. What happened to them? Because a family history is always important.
Yeah, my stepdad, actually, he died of prostate cancer. At that time, talking about the late 60s, it was sort of a radical operation. And
Did he have radical surgery?
Yes, he did. Yes,
and do you remember the surgery and what happened to him?
Well, I know that they had removed his prostate, and after that, all of his urinary functions were it went south.
So, do you remember him before the surgery?
Yes, I do.
You were a young man then?
Yeah, I was a kid. I was maybe preteen.
And so you knew him before, and then you knew him afterwards. And how did he change after that surgery?
Totally different. The cancer and the operation itself, it sort of destroyed his body, his functions, his spirit. He was just a totally different person.
And so he was never the same after that radical surgery. In which way?
He had lost weight to the point that he was maybe a strapping 180 pounds, and after the surgery and treatments, he might have gone down to like 119.
So he had a lot of trouble after the surgery. Because of the surgery or because of the cancer?
Because of the cancer. Because even after the surgery, the cancer wasn't totally gone.
So they tried to remove the prostate and they weren't successful?
No.
And the cancer came back?
Yeah.
And he suffered in pain?
Well, I wouldn't say suffered because they kept him sedated.
Well, that means usually if you're sedated, it usually means you're suffering. Right? So he probably was suffering. Would he go out to restaurants or go dancing or movies?
No, he was bedridden.
He was bedridden.
Yeah.
So he had the surgery, it didn't work, and he was in bed and died.
Yeah, basically. It was maybe a good 2.5, 3 months after the initial surgery that he had expired.
And do you remember all that period pretty well?
Yeah, pretty. We were very close.
You were living in the same house?
Yeah.
So it's pretty sad times.
It was. And to even expand on that, I had an uncle recently, like 25 years ago. He had a surgery.
For what reason?
Prostate.
So he also had surgery, radical prostatectomy?
Yeah.
And what happened to him?
He survived the cancer, but his urinary tract and his urinary functions were non-existent at that point. So
he had lost control of the urine?
Yes.
How do you know that?
Because he was wearing diapers. We confided in each other. Because being a family, we wanted to give a history of what was going on and what to expect if I ever got into that situation.
A lot of men don't confide those personal things. They're almost ashamed to tell that the urine isn't controlled.
My uncles, they were like my best friends as well as my mother's siblings. We were a close-knit family.
Did the surgery take away his sex life, do you know?
Yes.
So all his quality of life was damaged by that surgery?
Yes, it is.
But he survived?
Yeah, he's right now he's 83 years old.
So he survived 25 years?
Yeah.
And did his urinary control ever come back?
No.
Did his sex life ever come back?
No.
So he suffered?
Yeah.
And did it change his personality, that quality of life issue?
Somewhat. He's still the feisty sort of guy that I knew, but you can tell that like after the operation, it had a psychological change on his life and how he functioned.
Now, when you were a lot younger, you were like 30, 35 back then?
Yeah.
And then when your stepdad died, you were a teenager almost.
Yeah, basically.
So did you ever think about if prostate cancer ever happened to you, what treatment you would take? Did you ever get to that point in your thinking?
It had occurred to me when my uncle had the cancer. When my stepdad had died, it was a traumatic experience for me, so I didn't really equate it with me having it, and it wasn't really a concern. But after my uncle had it, and we were
because you were an older man.
Yeah, and we were the only two out of the family, out of our bloodline that actually had prostate cancer.
So then 12, 13 years ago, all of a sudden you were having urinary problems.
Yeah.
And you came to me and you were diagnosed with prostate cancer.
Yeah.
So what went through your head at that time 12, 13 years ago?
My first thought was, I'm going to die. There was, until you actually sat down and explained the what, the when, the where, the how, it actually scared me to the point I thought I was going to die. Okay, and after speaking with you, and you assured me that, you had a method that could directly eliminate this cancer.
Or try to eliminate the cancer.
Well, actually, you did, because
we'll get to that in a few minutes. But okay, but when you came to me, you were thinking in the back of your head about surgery and what it had done to your family, right?
Exactly. And
would you have ever had surgery? Go back 12, 13 years. If some surgeon came and he said, Johnny, I promise you're going to be fine, what would you have believed? Would you believe him, or would you believe what you saw with your family?
I would have believed what I saw with my family.
So what would you have believed if that doctor came to you and said, you come have surgery, I'm going to cut it out and you're going to be fine? What would you believe?
I would believe that right about now would be in Depends, diapers, with no urinary functions or no sexual functions. And that scared me. That actually scared me.
Did you ever see a surgeon about prostate cancer?
No, you were the only one.
Well, you had a biopsy, though.
Yeah. Oh,
so
that was
the doctor who biopsied you was a surgeon.
Right. That was Dr. Glock.
And did he recommend surgery for you?
Yes, he did.
He wanted to do surgery?
He wanted to do surgery, but when I spoke to you and you had suggested the body radio surgery, that seemed a little bit more to my advantage.
So why did you choose focused radiation over surgery?
Because of the after effects of the surgery. Because my stepdad and my uncle both lost their sexual prowess, after the surgery, and that concerned me.
So there was no way you would have had the surgery for the prostate cancer?
I don't think so, Doc. I really don't. To take away that function, that's sort of like taking away your manhood. And we as men, the only thing we do, we're protectors, we're lovers, we're dads. And, you take away that function from a man, what else is there to live for?
And what about the urinary control? How did that factor in with urinary loss of control with surgery? How was that? What was that in your thinking?
That sort of played. That was first and foremost in my mind, because I worked, as a background worker at the Javits Center. Also,
you were building buildings.
Yeah, and also as a carpenter. And these. If I had to worry about my urinary function, I couldn't get through the day. These guys aren't paying top dollar for you to stay half the day in the bathroom.
So you were fearful you'd lose your job also if you had the surgery.
Yeah,
you'd lose your job and your way of life.
Exactly.
So you came to me, and do you have any memory of what I told you and what I offered you and what kind of thoughts were in your head at that moment?
Well, like I said, and when you had ran down the procedure of what you wanted to do for my specific cancer, it assured me that, you were able to eradicate this cancer without ruining my sexual functions or my urinary functions.
But I can't promise guaranteed success. It's just a matter of statistics. Do you remember when I opened up the book and showed you the statistics?
Yeah.
You remember that. Did any other doctors show you the statistics?
No, not at all.
Did they show your your stepdad or your uncle, to the best of your knowledge?
No, during that time, that wasn't even in existence. I believe if it was, I believe that they would have had, that option to take that type of surgery. But at the time that they had it, it was nothing more than just a radical, invasive surgery.
Well, even today, most men who have radical never see the data.
Yeah.
And I can tell you, I see hundreds of men a year with prostate cancer, and they never see the data until they come here.
And it's that's the shame of it. I mean, the fact that now it seems as though with modern medicine, you have all of these different options in which to tackle the prostate cancer and other cancers, and all they're focused on is just the radical surgery of just cutting it out when you have so many other options.
Now, do you remember you were treated in the stereotactic frame? We brought the stereotactic frame in radiosurgery to America, and you were treated in that frame.
Yeah.
Remember that every day?
Yeah.
And what was your experience laying there in the frame? Was it comfortable, uncomfortable, claustrophobic?
Well, at first it was unnerving, only
Why?
because I didn't really know what to expect. When you made the body cast for me and you had that focused laser on my prostate, I didn't really know what to expect.
Did you feel anything?
No.
Did you have any pain?
No.
Did you have claustrophobia?
A little, because because of the edginess of that new experience. But after doing it, for the first week, and I believe after you had told me initially about the therapy, I think I might have missed a day, and I felt bad about it because I was a little ambivalent. But when you told me about this needs to be an ongoing procedure, that's when I got used to the idea of coming in, putting the body's cast on, and you putting me in the or your staff putting me in the laser room and giving me the therapy. That sort of put me at ease.
Now, during that time, you were working construction, right?
Yeah.
And you were in one of the high rises doing fancy work in fancy buildings, right?
Yeah.
And how much time did you miss from work because of the treatment?
Well, because of you.
Because of me.
Yeah.
Not because of you or the cancer, and because of me.
I think I had missed, it was like 2 weeks.
2 weeks. And why did you miss the 2 weeks? Because the treatment only takes a few minutes, right?
Yeah.
So why did you miss work if the treatment only takes a few minutes?
I took off that time. Because I was.
So you chose to take off that time.
Yeah.
But the other time you didn't. The other time you worked and you had the treatment simultaneously.
Yeah. Yeah.
So could you have worked throughout the whole period of time?
Yeah, absolutely.
Did you have any side effects from the treatment?
None.
Any pain?
No.
Bleeding?
No.
Any urinary problems?
None.
Rectal problems?
No.
Were you still making love 3 times a day?
I wish I was that impressive.
Don't be so modest.
No, but the fact is that just to be able to say that I can maintain my sexual prowess, that's everything for me.
Well, it's more than that, right? So this is now 12 years, is that right? 12 years later?
Actually, Doc, if you think about it, because I'll be 63 this month.
Happy birthday.
So we're talking about 13 years.
So it's 13 years.
You caught me when I was 50 years old.
So it's 13 years.
Yeah.
And your sex life is still working?
Yeah, thanks to you.
And your urinary life is working?
Yes.
And what's your most recent PSA?
It was, I think, 0.04.
Right. So you're in complete remission.
Yeah.
It's been 12, 13 years.
Yeah.
The PSA is 0.
Yeah.
Have you had any other treatment since the treatment that you had 12, 13 years ago?
No.
Have you had any surgery or Lupron or hormones or injections or chemo?
No.
So you had no more treatment. You had that short series of treatments.
Yep.
And you've been cancer-free 12, 13 years.
Yeah.
And
well, I've been cancer-free close to 8, 9 years.
Well, but since you had the treatment,
Yeah.
no further treatment, and the cancer went away. You mean that the PSA got down to 0?
Exactly.
But still, during that first 4 years, it was going down.
Yeah. Yeah, it was.
So you had the treatment, you've been in remission, no further treatment, 12, 13 years later, PSA is 0.
Yep.
And your quality of life is good.
Yes, it is.
Couldn't be, well, every men's could be better, right?
Yeah.
And every urine could be better. You could be urinating over a 3-rail fence, right?
Like a racehorse.
Like a racehorse. But your quality of life is as good as you could possibly expect.
Yes, it is.
And compared to your uncle or your stepdad?
Oh, I'm doing fantastic. I mean, like I said, one is deceased, and the other one, he's, really still suffering with that surgery that he had to go through, my uncle. But like I said, I'm very thankful for the fact that, like, during the time that I came along, there was an option that gave me or sustained my dignity as a man.
Now, how often do we see each other for checkups?
Well, after
Look, in the last year or two, how many times have you been?
like twice.
So checkups take how long? 15, 20 minutes, a
Yeah.
couple times a year?
Yeah.
Does
Talking about
it
everything
bother you
that's-
too much, or
No.
it makes you happy?
No, it makes me happy. I mean, just to be able to find out what's going on, and I mean, to come back to you like every 3 to 6 months, that's not an issue. And believe me, I'm glad that I've been doing it. I'm glad that like I met you during that time, because like I said, it's no telling with cancer what would have happened had I ended up in the wrong hands.
Do you have friends with prostate cancer?
No.
You've never met another man with prostate cancer?
Not of my peer groups or from my friends.
None in your intimate group?
No. So.
Do you know that the death rate of prostate cancer in the black community is 260% higher than other groups?
Yeah. Well, I know that it is high. I never knew the percentage, but I did know that it was
Pretty
higher.
frightening.
Yes, it was. And that was one reason why, like I said, back when I was first told that I had prostate cancer, that, the survival rate was so low that, I actually thought that I was going to die. But like I said, going through, conversations with you on how I was going to be going through the process and what was going to be done, it eased me. It put me at ease to the point that like I was ready for a new approach. And I'm glad, like I said, that we met.
Any regrets?
None. Not one.
And if you met another man with prostate cancer, what would you tell him? Would you tell him?
Listen, without a doubt, without hesitation, I would definitely refer them to you. I mean, and that's because I know that like I came through the dark side, and through you and your colleagues and your staff. Believe me, y'all showed me a different side of what cancer can be like. I didn't really think that it was going to be beatable.
Well, your words can save lives, and there'll be many people watching this, and I'm hopeful that your words can save the lives of other men and save their quality of life.
Well, and that's most important. I mean, the quality of life that you've let me maintain is that's invaluable. I mean, like I said, it's one thing to be cancer-free and not be able to function as a man, but to be cancer-free and still have that functionality as a man, that's everything.
Thank you very much.
Thank
God
you.
bless you.
Thank you.
Should live to be 120.
Okay, I wish. I wish.
Okay, thank you so much.
You're welcome, doctor. I appreciate you.